ADHD or narcissism, the overlap and misdiagnosis of similar traits. Welcome to another episode of Information for Life, Insights and Ideas to Navigate Your World. Today we're exploring an interesting topic that may have you reevaluating how you perceive certain behaviors, the overlap and misdiagnosis of ADHD and narcissism. This question was on my mind a few months back since I ran into this situation. What traits can appear as ADHD in a person who's adopted narcissistic traits as a maladaptive coping mechanism? Is one sign of potential misdiagnosis that the medication prescribed makes them feel, in their words, cracked out? To answer this question, let's acknowledge that ADHD and narcissistic traits are distinct conditions with different treatment approaches. American Psychiatric Association, 2013. Misdiagnosis can lead to ineffective treatment and potentially worsen an individual's symptoms. However, it does turn out that some individuals with narcissistic traits may exhibit behaviors that could be mistaken for ADHD. For example, they might have difficulty focusing on tasks that don't directly benefit them or hold their interest, or they may struggle with impulsivity and act without considering the consequences. Muti and Pinto, 2020. These symptoms would typically be accompanied by other behaviors consistent with narcissistic traits, such as preoccupation with their own needs and desires, and a lack of concern for others. ADHD, Attention Deficit Hyperactivity Disorder, and Narcissistic Personality Disorder, NPD, are distinct conditions with differing symptoms, diagnostic criteria, and treatment approaches. However, some symptoms may overlap, leading to confusion or misdiagnosis. Let's explore each condition in more detail and discuss the overlapping symptoms. ADHD. ADHD is a neurodevelopmental disorder characterized by inattention, hyperactivity, and impulsivity symptoms. It affects both children and adults and can interfere with various aspects of life, including school, work, and relationships. The primary symptoms of ADHD are 1. Inattention, difficulty focusing, trouble organizing tasks, forgetfulness, and frequently losing items. 2. Hyperactivity, constant fidgeting, difficulty staying seated, excessive talking, and restlessness. 3. Impulsivity, acting without thinking, interrupting others, and difficulty waiting for their turn. Narcissistic Personality Disorder. NPD is a personality disorder characterized by an inflated sense of self-importance, a constant need for admiration, and a lack of empathy for others. People with NPD often have fragile self-esteem and may be overly sensitive to criticism. The primary symptoms of NPD include 1. Grandiosity, exaggerated sense of self-importance and belief in their superiority. 2. Need for admiration, seeking constant praise and validation from others. This need is due to the fact they never get to know themselves and so require external sources to tell them who they are. 3. Lack of empathy, difficulty understanding and appreciating the feelings and needs of others. 4. Exploitative behavior, manipulating others for personal gain or maintaining their inflated self-image. 5. Envy, feeling envious of others or believing that others are envious of them. It's possible that an individual who has adopted narcissistic traits as a maladaptive coping mechanism may be misdiagnosed with ADHD if they seek medication to manage their symptoms. Stimulant medications commonly used to treat ADHD can have side effects such as increased heart rate, decreased appetite, and difficulty sleeping. National Institute of Mental Health, 2018. Some individuals may describe feeling cracked out or overly stimulated when taking these medications, which could indicate that they are not the appropriate treatment for their symptoms. Overlap and misdiagnosis. Some symptoms of ADHD and NPD may overlap, leading to potential misdiagnosis. For example, impulsivity is a common symptom in both conditions. In ADHD, impulsivity may manifest as interrupting others or acting without thinking, while in NPD, it can be seen in the context of manipulating others or making impulsive decisions to maintain their inflated self-image. Another overlapping symptom is difficulty focusing. In ADHD, this difficulty is related to the inability to concentrate on tasks or activities for an extended period. In NPD, individuals may struggle to focus on tasks that don't directly benefit them, align with their self-image, or hold their interest. It's essential to recognize that these overlapping symptoms don't automatically mean someone has ADHD and NPD. A comprehensive evaluation by a mental health professional is necessary to determine an accurate diagnosis and appropriate treatment. Treatment. Treatment for ADHD often includes behavioral therapy, psychoeducation, and medication, such as stimulants like methylphenidate or amphetamine. Treatment for NPD primarily involves psychotherapy, such as cognitive behavioral therapy, CBT, psychodynamic therapy, or dialectical behavior therapy, DBT. There are no approved medications specifically for treating NPD, but some medications may be prescribed to address co-occurring issues like depression or anxiety. Suppose someone is experiencing symptoms that interfere with their daily life and relationships. In that case, they must seek a comprehensive evaluation from a mental health professional to determine an accurate diagnosis and appropriate treatment approach. In conclusion, while ADHD and NPD have some overlapping symptoms, they are distinct disorders with different diagnostic criteria and treatment approaches. A thorough evaluation by a mental health professional is essential to ensure accurate diagnosis and appropriate treatment. Here are some reputable sources that can provide more information on ADHD and narcissistic personality disorder. Regarding ADHD, 1. American Psychiatric Association, 2013. Diagnostic and Statistical Manual of Mental Disorders, 5th ed. Author. This manual provides the diagnostic criteria and descriptions for ADHD and other mental disorders. 2. National Institute of Mental Health, 2018. Attention Deficit/Hyperactivity Disorder, ADHD. This webpage offers a comprehensive overview of ADHD, including symptoms, causes, diagnosis, and treatment options. Regarding narcissistic personality disorder, 1. American Psychiatric Association, 2013. Diagnostic and Statistical Manual of Mental Disorders, 5th ed. This manual provides the diagnostic criteria and descriptions for NPD and other mental disorders. 2. Mayo Clinic, 2020. Narcissistic Personality Disorder. This webpage offers a comprehensive overview of NPD, including symptoms, causes, diagnosis, and treatment options. Regarding overlap and misdiagnosis. 1. Mauti, A., and Pinto, A., 2020. The Overlap Between ADHD and Narcissistic Personality Disorder. Journal of Attention Disorders, 24-1-90-98. This study explores the overlapping symptoms between ADHD and NPD, highlighting the potential for misdiagnosis and discussing the implications for treatment. These sources can provide you with more detailed information about ADHD, narcissistic personality disorder, and the potential for overlap and misdiagnosis. That's it for today's episode. As always, seeking help from mental health professionals when you suspect a misdiagnosis or require assistance in understanding your condition is essential. Thanks for joining us on Information for Life, insights and ideas to navigate your world. See you next time.